Wellness and Integrative Health Center, and on the cancers that affect the Latinx community. So cancer detrimentally affects families and the patients. So not only are the patients affected, but their families are involved, and they need a support center that can help them deal with and cope with the disease. So as we were researching, we found that prostate and breast cancer are two of the most prevalent cancers in the Latinx community. And 1 in 7 men are diagnosed with prostate cancer every year, which is a huge number, especially considering that the population is huge. Now, cancer, as we all know, is caused by a mutation in the DNA, which causes an increase in cell growth, which causes these cancerous tumors within the body. There are many types of prostate cancers, as I researched, and it just depends on where it's located in the prostate and which tissues are affected. Most prostate cancers are developed in the gland cells, and it mostly occurs in older men. This cancer can also metastasize, and it can move throughout the body and affect other areas of the body, whereas instead of just the prostate. There's also just a 5-year survival rate for those who are diagnosed with prostate cancer. Now, our goal is to provide an outreach for the Latinx community so that they can find that amazing quality of life that they knew before they were diagnosed. And as you can see, like with the cancer, how it affects the body, which Corinne and Sarah will also discuss later on in this presentation, about like the treatments and how it affects their body, and also how cancer just affects the body. You can see that there's like a loss in their quality of life and how they were living before, and they need to find that again. So we want to be able to provide this resource and release for cancer patients that as they are going through this process to be able to find that quality of life that they had. Now, HCI provides many resources for these patients and a great support system already, and Madison will also present on that as well. Now I'm going to pass it on to Ashley to discuss breast cancer.
So breast cancer is the most commonly diagnosed cancer within the female population. 1 out of every 8 women will most likely be diagnosed with breast cancer. And the death rates have declined in recent years because of breast cancer, because it's been easier to find in earlier stages, because we have mammograms and people are checking their breasts more often because of awareness of breast cancer. And there are environmental risk factors that people need to be aware of, like being overweight, a poor diet, lack of physical activity, and drinking alcohol. And with the Latino population, most Latino women, about 32% of them actually don't have insurance, and so they're less likely to get mammograms. And also, as the Latinx group said, that they also have misconceptions that mammograms may cause cancer, and they are less likely to develop cancer, but they are more likely to die of breast cancer because it's more likely to be found at a later stage that's harder to treat. And there are 4 stages of cancer, and the first stage is the easiest to treat, which is stage 1, which is just a small tumor, and the last stage is stage 4, where it's spread out of the breast and into the rest of the body, which is usually when it's found in communication patients.
So like she said, I researched the effects of cancer. You can think of like the physical effects of cancer are the first thing you think of with treatment, when your hair falls out and pain and fatigue and all of that. But what I found is that one of the hardest things that people have a hard time coping with are the effects on their family and on their emotional needs. Family roles and responsibilities can change, and future plans have to be put on hold. And like the Latinx group said, family is very important to the Latinx culture. So I think it's important to incorporate that into this project. Some of the ways that I looked at to cope with the effects are to accept your fears and to communicate with your family and your doctors, and to have a healthy lifestyle, which I think that this whole project we're trying to come up with is that's what we're trying to do, is help them cope with these effects. And
Okay, so I'll just name a few treatments. So there's radiation therapy, chemotherapy, surgery, and then immunotherapy, which just uses your body's immune system to help fight cancer. And then I'll just focus on breast cancer and prostate cancer and the treatments that have been done for those. So one of the leading treatments for breast cancer was the use of a drug called tamoxifen, and it's been shown that it reduces the annual rates of breast cancer recurrence by almost half and mortality by 1/3. And then for prostate cancer, the common treatment has been radiotherapy, which has evolved to the development of techniques to focus a radiation beam on the target, and also the use of androgen deprivation therapy for 4 months before and after radiotherapy was associated with a decrease in the disease-specific mortality and increased overall survival. And that information was found on the New England Journal of Medicine. And now I'll just pass it over to Madison, who's going to talk about HCI.
Okay, so what I found researching the Huntsman Cancer Institute is that overall they serve many cancer patients in the Intermountain West region through not only treatment and patient care, but through research and education, such as preventative care and coping mechanisms and things like that. And when I was looking, and even when we visited, I found it very helpful that they have the Cancer Learning Center. It's a great resource for just information on anything from basic cancer to alternative treatments and even tips on coping mechanisms. So, and it's also a great source of information for patients just besides their